I'm Dr. Natalie Lawrence, and I've been in private practice here in Dacula, Georgia at Lawrence Chiropractic Center since 2002. I am a graduate of Life University in Marietta, Georgia, and I'm also a member of Functional Medicine University. I have completed over 100 hours of metabolic assessment and functional medicine training through Apex Energetics, and I'm a member of Dr. Michael Johnson's Chiropractic Neurology Group, which is a group of 500 doctors throughout the country who specialize in treating patients using brain-based techniques. We also consult on a variety of chronically ill patient cases in utilizing that as well. Dr. Michael Johnson is the author of the book, What Do You Do When the Medications Don't Work? And we also have a group website that's at www.lifechangingcare.com. Feel free to check that out. There's a lot of really great videos and testimonials from patients who are being helped with this type of care. So if you suffer from any of the following conditions, neck pain, back pain, sciatica, stenosis, failed back surgery, then the care that we offer in our office may very well be the missing piece of the puzzle to you getting your life back. We use a variety of technologies that help all of these conditions. Maybe in the past you've had epidurals, maybe you've had physical therapy, maybe you've been to another chiropractor, or any number of variety of things from pharmaceuticals to other interventions. What I'm here to tell you today is that what we do in our office is very different for a couple reasons. It's very different because we treat you using neurological treatments and brain-based therapies. So initially what we're going to do is we're going to neurologically test you to find out if there's a problem with the way that the brain works. Okay? So not only are we going to treat the spine itself, but we're also going to check the brain to make sure that everything is working the way it's supposed to. And if it's not, then we can go ahead and utilize treatments that will help that as well. We use something called spinal decompression, non-surgical spinal decompression. And let me tell you a little bit about that. Orthopedically, what spinal decompression does is it helps to separate the vertebra so that if you have a disc that's bulging out, it will help to suck that back in. And when that happens, then it will take the pressure off the nerve, which will decrease the ability of that nerve to give you a pain signal down into your lower back, your neck, or your arm or your leg. Neurologically, what it's going to do is it's going to create a slow stretch in the back. And when that happens, it's going to fire receptors. And those receptors are going to fire up into the spinal cord, into large diameter afferents that will in turn travel up the cord and fire off the cerebellum, which is a good treatment for lower back pain. We may use brain-based therapies such as unilateral adjustments. You may have been to a chiropractor before who's adjusted you on both sides. Here at our office, we adjust one side. Let's say that when we checked you neurologically that we found that you had a left brain deficit. Now, as you guys know, left brain controls the right side of the body. So in this situation, if you have a left brain deficit, we would want to adjust you on the right side to stimulate the left brain. That makes sense, right? It makes sense to me. Some of the other things that we would want to do maybe to simulate the cerebellum, if that were a problem, are to use something called a squeeze ball. Right hand, if you have a right cerebellar issue. We could also have you do smell something into the nose. We can have you listen to things, audio therapy. We could do eye stimulation, any number of things. And again, the treatment that we use is based specifically on what your case and what you showed in your neurological evaluation, what you showed that you needed. When we do these things, when we employ these techniques, we get a great result with you. By using the non-surgical spinal decompression along with the brain-based therapies, we at Lawrence Chiropractic Center are on the cutting edge of taking care of these type of syndromes, and neck pain, the back pain, failed back surgery, and stenosis. Let me talk about stenosis for a minute, because this is a really common problem that we see with people, especially with those of you suffering with chronic back problems. Stenosis basically is a foraminal narrowing, or a narrowing of the spinal canal. And there are a couple causes for this. Number one, we can have something called a spondylolisthesis. Big fancy term that simply means that the vertebra, normally L5, sometimes others, has slipped too far forward. We can help you with that. You can also have something called a retrolisthesis, where the vertebra slipped too far back. We can help you with that. There's also something called central canal stenosis, and that's where the cord is actually being choked in the vertebral column, and we can help you with that. And we can do all of that without medicine and without surgery. So if you're suffering from one of the problems that I've described earlier, and you would like to have more information about how we could possibly help you, if you fill out this form to your right, we will get you a DVD in the mail for no charge, and it's a DVD that's going to outline non-surgical spinal decompression and the brain-based therapies that we offer at our office. And if you fill the form out, we'll get you one right out in the mail. It's going to tell you how you can contact our office so that you can set yourself up an appointment to come in for an evaluation to see if what you have is something that we can take care of with the protocols that I've been describing earlier. So once again, my name is Dr. Natalie Lawrence. I appreciate you taking the time to watch this video, and I look forward to helping you at the office.